Now, if you're watching this video, I bet you're wondering if you have ADD. I think you can agree with that. What we're going to do is we're going to talk about ADD and its core symptoms, where it comes from, how it manifests, and all sorts of questions that I'm sure that you have. They'll be answered by this video. So let's get started. I'm going to ask you a question first. Does this sound anything like your experience? I wish you'd just work harder. If you just apply yourself, if you just buckle down and work harder, you'd get better grades. I know you can do it. Well, this is a familiar scenario for a lot of people. And realize, first of all, this is not something you choose to do necessarily. And that doesn't mean that you can't take responsibility for those symptoms and do something about it. And we'll talk about what to do. So, where does ADD come from? Well, one of your parents has it because it has a genetic link to it. And it has to do with the functioning of the brain and the transmission of two crucial neurochemicals, dopamine and norepinephrine. There are three core symptoms to ADD. They are inattention, hyperactivity, and impulsivity. But basically, this was a brain adapted for another time. Back in our evolution, when we were hunter-gatherers, this was the brain to have. It's what I call a stimulus-driven brain. It craves particular stimulus. And that lends itself to life as a hunter-gatherer. You're always curious, what will be over the next hill? What will be around the corner? And that adaptation was the brain suited for survival at that time. So we wind the evolutionary clock forward, and what do we find? We find numbers of people like us growing. And what happens with that is social structure takes place. With social structure comes organization. And we see jobs like watching plants grow, counting beans, all sorts of things that job-wise the ADD brain is not well wired for. Let's again revisit that evolution of ADD. Some people theorize that women were more attracted to risk takers. This increased the frequency of these key genes that predispose one to hyperactivity and impulsivity. They exist today in the gene pool at a static rate of about 5%. Others claim these were an adaptation to a dangerous life where it was stressful and the environment provided many, many dangers. And this allowed one to increase impulsivity and exploratory behavior. ADD is poorly named. One of the aspects about ADD is, yes, to be sure, inattention. But again, it is not the lack of ability to pay attention, because the other side of the coin is something called hyperfocus. And that's a trait that many people try and cultivate. Imagine the role of a surgeon who's doing a 5-hour surgery. Don't you wish he was hyper-focused, or she, as the case may be? Well, we find that 5% gets perpetuated at a steady rate in the gene pool. But it's both overdiagnosed and underdiagnosed at the same time. So what do I mean by that? One can't just look at the outcome of behavior. You know, I was cleaning my basement with my wife, and it was only then that she figured out that, I have ADD. And because I was like a bee going from flower to flower. Yes, at the end of the day, the basement was clean. But that process was different, and she could tell it most clearly by watching me work. And so many people have this process that's often a key to whether they have ADD. Sometimes it involves being what I would call deadline driven. Does this sound familiar for you? Oh, there's no better time to do a paper than Thursday night when it's due on Friday. People with ADD often have patterns that make them stick out. We find that people with ADD, by and large, are pretty smart. And that's all to the advantage. When you have horses to run with, you can pull off things like doing a paper at the last minute and having it turn out just fine. But it's often these patterns or a sense that you have to work harder. The takeaway also about ADD is it has absolutely nothing to do with intelligence. Intelligence, in fact, is skewed to the higher end of the continuum by a significant amount. I have many clients in my practice who have terminal degrees. They are physicians, they are attorneys, they are scientists. And I have way too many people with a master's degree to even think about counting. Yes, ADD tends to skew to people who are bright. But often there's a book out there called I'm Not Lazy, Crazy, or Stupid. And I love the title of this book because at times people feel that way. Oftentimes, performance is just a poor reflection of intelligence. Boredom figures into that equation. Boredom factor in school detracts from performance. So we're going to do a little Jeff Foxworthy action. See if these things sound familiar, because these are core inattentive symptoms. If you make careless mistake and you lack attention to detail, you might have ADD. Examples are overlooking or missing details and handing in work that's often inaccurate. If you have difficulty paying attention to tasks, you might have ADD. An example of this is difficulty remaining focused during lectures or conversations or lengthy readings. Oftentimes I have people tell me that they're in a group conversation and their mind is wandering and somebody asks them something and they're kind of lost. If you fail to follow through on instructions or chores or duties, particularly in the workplace, but at home too, you may have ADD. One example of this is you start tasks readily, but quickly lose focus and are easily distracted. Do you have a bunch of tasks that are about 90% done? Yeah, that's a common thing that people experience. If you have difficulty organizing tasks and activities, examples of this are messy, disorganized work, poor time management, and that's something that's really interesting because people with ADD often have a really poor sense of the passage of time. Fails to meet those deadlines. That deadline, they're both helpful and they're always lurking over your shoulder. So if you avoid or dislike or you're reluctant to participate in tasks that require sustained mental effort, you might have ADD. An example of this is that you avoid or dislike preparing reports or completing forms or reviewing lengthy papers. Do you lose things that are necessary for tasks or activities? Examples of this are tools, wallet, keys, paperwork, eyeglasses, and mobile phones. It's interesting because for a lot of kids, they may do their homework essentially with a parent supervising and telling them, hey, you gotta get this done, and then forget and leave it at home. ADD is something that exists from childhood. You're born with it. Again, that genetic link. And these are all part of that core symptom set of inattention. So let's talk about that other core symptom, hyperactivity. If you leave your seat when remaining seated is expected. Examples of this is kids particularly. They have trouble sitting still. But do you leave your place at the office or other workplace settings? Do you just have to get up and walk around? These are situations that often require sitting. Do you find it's hard to sit still without getting up through a television program? Oftentimes, that is excruciating for people with a big hyperactivity component. for kids, running and climbing where it's inappropriate. And their feet and legs are often restless. They often move. It's an internal restlessness. You know, at my office, which I like to visit during COVID, I don't get there much, I had this wonderful rug, and it was a very sophisticated assessment device. When a person had a significant hyperactivity component, they'd always put wrinkles in the rug. And I was tracking when I noticed this co-occurrence. And it worked out 100% of the time. For adults, they may fidget. They may have things in their hand or always need to have some part moving. The interesting thing is, pure hyperactivity is actually fairly uncommon. And women tend to have less hyperactivity than men overall. But when women have hyperactivity, they tend to have a lot of it. I remember one of my patients was in nursing school, and people actually refused to sit by her because she was so squirmy and fidgety. It was really a distracting thing. Do you find yourself unable to participate in various leisure activities? You act as if you're on the go or driven by a motor. It's that whole sense of being uncomfortable sitting still. Talking excessively. Do you tend to blurt things out? Do you tend to answer the question before someone has even finished talking? Well, this is an example of impulsivity. One simply has trouble waiting one's turn and impulsively jumps into the conversation. Impulsivity takes a variety of shapes and forms for people. Sometimes it can be making quick decisions without prudent thought. Sometimes it can be even sexual activity where one impulsively, engages in stuff without even knowing the outcome of those behaviors. Sometimes we, get involved in relationships that aren't good for us. And, that's one of the manifestations that can happen. That whole aspect of impulsivity is charged by the fact that a lot of times when we act impulsively, we get a big old charge of dopamine, and that's actually pretty reinforcing. So we have these three core symptoms, and I want to ask you a question, and you can respond in the comments. What symptom most struck gold for you? What are the ones that you deal with most? Are they on the inattentive vector of symptoms? Are they on the hyperactivity vector of symptoms? Or do you have a smattering of both? There are three subtypes of ADD. It's not ADD over there, ADHD over there. Technically, it's all ADD/ADHD with three types being predominantly inattentive, predominantly hyperactivity, and combined, which is just what it sounds like, combined. You have them both. And actually, combined is probably the most common that I see. What can you do about it? First, seek treatment from a qualified individual. And this isn't necessarily something that's really well under the umbrella of primary care providers. I have seen more unfortunate mistakes where primary care providers in their 9 to 12 minute time with each patient really misses the ball. ADD is marked by comorbidities, things that happen along with it. These are things like anxiety, OCD, and bipolarity spectrum disorders. I wish I had $10 for every person that I saw in the emergency room who a primary care provider gave them stimulants when they had underlying bipolar. Bad things happen. And so go to somebody who's qualified. Yeah, once you get dialed in and the heavy lifting is over and you're on a satisfactory regime, then your primary care provider, they oftentimes are willing to kind of pick up that ball and maintain your prescriptive needs. Even though medications are empirically shown to be twice as effective as all the biobehavioral interventions, Those biobehavioral interventions are really important, and I am a believer in them. I practice them myself. These consist of things like targeted use of exercise. Exercise helps dial in the brain, and it's an adjustment on those neurochemicals. Often the effect of aerobic level exercise will last hours. I know qualitatively I have better days when I exercise to start my day. I am a big proponent of meditation. I've been doing it since I was taught in the military when I was in my 20s. It is really useful. And what it fundamentally is training in focus. And what we're talking about here is mindfulness meditation. Intrusive thoughts come in and you push them to the side, initially to focus on physical sensations that we usually tune out. And what is focused attention but pushing away the distractors? Another one is what we eat and when we eat it. Let's get back to our ancestry, where we were a developing species. We were designed to be both a grazer and a gorger. And too often people tend to graze on a gorger intake. That doesn't work so well. But what we eat, protein fuels the brain. Carbohydrates make it sleepy. I am a proponent of eating multiple times if you have a work day. And these aren't full meals, these are little meals. And most important is coaching. Now that's a great segue to the fact that if you're watching this YouTube video, you've come to a channel that coaches ADD. And I want you to think about subscribing. I want you to think about sharing this, because if you have people who might be wondering, or you kind of know they already do, have ADD, this might be a useful, informative video for them to watch. I appreciate you asking questions about ADD. Feel free to use the comment section. I will respond to those comments and questions. And the reality is, your question is likely something other people have as well. So this has been G.H. Glade for Coaching ADD, and I hope you liked this video. I appreciate you spending the time with me, taking time to spend about 20 or so minutes watching this video and becoming more informed. And if you like this video, come back next week when I'm going to do another one. And that'll be on Monday when I release these videos. Take care, and I hope you have a fabulous day. Bye-bye.